Facility dollars and operational dollars to apply towards our agency will alleviate this cluttered space that we're working out of. Not only are the spaces confined and not adequate for testing and providing in a clinical setting, what we learned is our HVAC system was not adequate and did not have a proper flow system. So I'm going to point out the spots, the cracks, and how the building's pulled away, and we need critical funds for an engineer assessment and to repair. Your generous leadership and support of facility dollars for urban Indian programs, including the Urban Indian Salt Lake, will allow us to get back to some sort of normalcy, but at the same time, provide us the much needed critical resources to expand our services and programs following safe guidelines.
In 2018, Native American Lifelines experienced a flood in our facility in Baltimore, creating a toxic environment of black mold, meaning that we could no longer see our clients or even work there safely. This happened at the same time as the federal government shutdown and also a proliferation of opioid overdose fatalities in our community, meaning that there was no one place for us to gather with them and provide in-person services at a time that they needed us most. Now, we did find a temporary space, but it doesn't meet all of our needs, like a dental program, medicine garden, a NEPI, place for physical activity, things that community members say that they value. We need funding of facilities and urban programs, not only to honor the dignity of our clients, but also to honor the federal trust responsibility owed to tribal citizens. We hope that this is a reality in the near future.
The Oklahoma City Indian Clinic is a patient-centered medical and dental home to over 21,000 American Indian Alaska Natives. The patient reception area is the main area that holds hundreds of patients throughout the day that visit our clinic for a variety of robust medical services. The reception area is one prime example of an area that needs to be renovated to mitigate the risk of COVID-19 and other communicable diseases. Without access to facility dollars for improvements and renovations, it makes it extremely difficult to budget for these costly but necessary upgrades. Having access to facility improvement dollars will lessen the burden on taking money from direct patient care services and allow for maintenance and improvements that will only enhance our efforts to provide excellent health care to American Indians and Alaska Natives in a clean and safe environment.
All Nations is committed to providing healthy, sustainable lives for our natives and all of our neighbors in Missoula. A new building for All Nations would allow us to provide more services and better quality services to help improve the health of our community here in Missoula for generations to come.
Hi, my name is Aaron Walkinney. I'm the Contracts and Grants Program Manager here at Denver Indian Health and Family Services. I'd like to show you a few areas of our facility and why we would benefit from funding to increase our capacity. Come on.
The Native Project is located in the City of Spokane's 3rd Legislative District, most commonly known as West Central, which resides within the poorest legislative district in Washington State. The majority of urban Indians who reside within Spokane County's boundaries are located in the West Central or Hilliard neighborhoods. If given the funds to expand, build capacity, and enhance our program services, the Native Project would be able to serve more American Indians and Alaska Natives for the next 7 generations to come. We're ready.
In 1971, our founders, local American Indian activists, started the Indian Health Board. Health disparities were high and rising. Access to care were low and often met with discrimination. In the 1980s and 90s, we added primary dental, and behavioral health. In the 2000s and 2010s, we stood with our community and fought with others in the meth and opioid epidemics, providing enhanced and more integrated care. During the pandemic itself, we bought and opened a new counseling center and an idle building across the street to use as our testing and vaccination site. The American Jobs Plan funding will help us do more to invest in our community's future, revitalizing and repurposing our aging buildings into a campus of state-of-the-art medical and dental facilities will make healthier lives, employment growth, and a more sustainable future for our urban American Indian community.
Facility funds for First Nations Community Health Source, New Mexico's Urban Indian Health Center in Albuquerque, are well overdue and badly needed. The current state of our physical space and facility in many ways dictates what we can provide, how we staff our programs, and how we provide our services. Without facility funds, our ability to grow and operate efficiently and effectively becomes more challenging, which inevitably impairs our ability to meet the healthcare needs of our urban Indian community members. An example is our dental facility, which is housed in a 20-year-old modular. This modular is continuously challenged by roof leaks, uneven and sagging floors, peeling stucco, cracked walls, and limited space for our sterilization and lab needs. Oral health is a major health disparity among the 55,000 urban Indian community members living in Albuquerque. Our clinic is the only dental clinic dedicated to serving urban Indian adults in Albuquerque. With the limitations of our dental clinic's physical space, we are at capacity with serving 3,000 patients and 10,000 patient visits per year. Facility funds would allow us to create a more permanent dental clinic structure, improve our patient flow, increase our capacity to serve more patients, improve patient and staff levels of satisfaction and retention, and decrease liability risks. Our main clinic is housed in a 40-year-old facility, which has some similar facility limitations, with poor roofing, cracked and worn hallway and office tiles, fixtures that are not eco-friendly, limited office and storage spaces, small waiting rooms, and small exam rooms and offices. Facility funds are a critical way to help us reduce costs, but also to be more responsive to our community's needs. The COVID-19 pandemic has taught our health center many things. Among the most important is a critical role that our facility has in reducing infection rates. If our facilities are already limited in meeting the day-to-day facility needs, changes in diseases, healthcare crises, and changes in our patient population will exacerbate these limitations and impair our ability to serve as an effective health resource care center. Thank you.